Check, check. Check, check. Check. Check.
think we'll go ahead and get started. Welcome everyone to Grand Rounds. My name is Claudia Fox. I'm the medical director of our weight management program. And today I have the distinct pleasure of introducing our speaker, Dr. Nick Edwards. Dr. Edwards completed his pediatric residency at the University of Wisconsin and then completed 2 fellowships, one in sports medicine here at HCMC and another one in academic general pediatrics here in our department. He is currently an assistant professor at Cincinnati Children's Hospital, where his primary clinical work is in the Division of Sports Medicine. Dr. Edwards also sees patients in Cincinnati Children's Heart Institute, where he cares for children with obesity. He has been active in the education of the public and health professionals regarding sports-related injuries. He is also the recipient of several grants, including a K Award, to examine the effects of physical activity on cardiovascular risk factors in youth. Nick made Herculean efforts to get here today through the snow and multiple plane trips, so please join me in giving him a warm welcome.
Thank you, everybody. Thanks for coming, and thanks, Claudia, for that introduction. So I think this is timely because I'm going to talk to you about exercise that you can do or your patients can do poor levels of fitness were associated with less favorable cardiovascular risk factors. Better fitness, more favorable levels of cardiovascular risk factors. Like I said, something that we take for granted today, but at the time this was groundbreaking and landmark. But what people thought of exercise back then was you'd go out for a long run, start running at a certain intensity and stop, and you're done with your exercise. And that was what people were focusing on as far as endurance training and exercise for health for a long time. One of the first studies where people started to think a little bit differently about continuous exercise and start to think about this interval exercise protocol was when somebody named Izumi Tabata out of Tokyo looked at this. He took 14 students and randomized them for 6 weeks of riding on a stationary bike 5 times a week. And for interval exercise, they did 20 seconds at 170% estimated exercise capacity and 10 seconds rest. And they did that for about 7 to 8 minutes. And then they had another group that just worked out continuously at 70% capacity for an hour. And they tested their fitness level, their oxygen uptake. And what they found is both groups increased about the same amount. Both groups increased their fitness. So you had one group that was exercising for 7 or 8 minutes, one group for an hour, and similar levels of improvement in fitness in both groups. So sometimes when you hear people talk about this, you might hear the term Tabata training, and this is why they use that term. And since then, there's been an increase in interest in this type of training. And Tabata was looking at healthy young adults. It was this Norwegian group, Ragmo and Tiona and others, that started to apply this type of exercise in people with chronic disease. So 2004 published a paper looking at adults with coronary artery disease, and they did what I will call the Norwegian protocol, where they had folks exercise for 4 minutes at 85% of their capacity, rest for 3 minutes, and cycle back up and down for 4 cycles. They looked at that group, and then they compared it to a group who they just had exercise at a continuous intensity for 40 minutes. And they found that the interval group had their fitness increased by 18% versus 8% for the continuous exercise group. So this was, I think, the start of trying to apply this to patients and folks with some underlying condition. Now, since 2004, there have been quite a few studies that have come out in adults. And so people have looked at this in meta-analyses and found favorable effects of interval exercise compared to continuous intensity exercise with the effect on fitness. And remember from that Cooper study, fitness is associated, better fitness associated with better cardiovascular risk factors. But people have also demonstrated a more direct effect on these risk factors, even in some of these pooled meta-analyses. So this is a study that came out in 2015 out of England, and they looked at the effect of interval exercise on several different components and compared interval to control groups in adults, and found that interval exercise reduced insulin resistance more than folks in control groups when you pool these studies together. There have been a lot of other studies in adults looking at adults with type 2 diabetes, adults with non-alcoholic fatty liver disease, and found that it's improved some of these outcomes. Vascular effects, so when we've looked at when people have looked at flow-mediated dilation, they found that interval exercise is advantageous over continuous intensity exercise. And this is from 2015, Joyce Ramos in Australia pulled a bunch of studies together, favorable effect of interval exercise. So what about in kids? That's what I'm sure you all are more interested in today than adults. Ali McManus was one of the first investigators to look at this back in 2005 out of Hong Kong. She took 35 10-year-olds and had them get on a cycle a few days a week for 8 weeks, and had them do 30 seconds at 100% and for just under 3 minutes, and then cycle back and forth 7 times, versus another group, control group, that they had do continuous exercise at about 80% for 20 minutes. And in both groups, their fitness level increased. So one of the first studies to show that if you cycle up and down, you can get improvements in fitness in kids too, not just in adults. Since this study, there have been quite a few studies on kids that have come out too, and I'm going to highlight a few for you today. So back to this Norwegian group, 2009, Tiona published a paper where they took 54 overweight children, so BMI over the 85th percentile. They're about 14 years old on average. For 12 weeks, had them run on a treadmill and do that Norwegian protocol that I mentioned before. So 4 minutes at 90 to 95% exercise capacity, 3 minutes rest, and then 4 total cycles. And then they had a control group that they gave advice to exercise more. And the interval training group increased their fitness by 11% versus the advice group. So as more evidence has accumulated, people have started to look at a few different health outcomes. Chinsiri out of Bangkok in 2015 looked at 35 kids who were 10 years old. Half of them were obese, and had them do. This protocol was more similar to that Tabata protocol, where they're doing 20 seconds at. And they actually changed up a little bit, where they did different intensities: 100%, 130%, and 170%, and then cycled back down for 10 seconds of rest. They found that as the intensity increased from baseline to 100%, 130%, 170%, you had a greater effect on pulse wave velocity and flow-mediated dilation. So it seemed like there was an intensity effect on these vascular measures. So as people have dove in a little bit and realized that this interval exercise is good and started to play with some of these variables, we've been learning more. And I think this is a really interesting study that Greg Logan authored out of New Zealand, came out in 2015. They took 26 adolescent boys, and at baseline, these kids were not very active, and split them into 5 groups. So they're doing that Tabata protocol, the 20 seconds of high intensity, 10 seconds of lower, and had them do a total of 2, 4, 6, 8, and 10 minutes. So 5 different groups, the total time, 2 to 10 minutes. Not very much time spent on exercising. They did this protocol a couple times a week for 8 weeks. And then they tested their fitness, body fat, and some other factors. And what they found was that if they pooled everyone together they saw an effect of the people who did this protocol, that they did improve their fitness and they improved their body fat, but they didn't really detect a difference between the different groups, whether you did 2 minutes or 10 minutes. So you could potentially see a benefit even if you were in the group that did only a total of 29 minutes over 8 weeks versus the group that did 2.5 hours over 8 weeks. So we're not talking about a whole lot of exercise here, and some of the folks, and you can see it plotted out here, not everybody gets a benefit, but some people did, and this goes from left to right. This is the 2-minute group, 4, 6, 8, and 10. Same thing over here, 2, 4, 6, 8, 10. And not everybody had an increase in their fitness or a drop in their body fat percentage, but quite a few did, and they weren't able to detect a difference between the groups. So let me tell you a little bit more about our experience at Cincinnati Children's with this. So for a while, we've offered group exercise to folks that are coming into the weight management program, 5 days a week, a couple different hour sessions for different age groups. And we have a space where there's some exercise machines and weights, and it's led by a couple exercise physiologists, and they lead the kids through various activities with the goal of keeping them moving for most of the hour. And there's also a small gym where they play games and do different activities to change it up a little bit. So we were reading more about this interval exercise and wanted to see if it's something that we could apply at our center. And so we did this sequential, non-randomized control trial, and this grew out of a medical student project by Ann Murphy, and it was funded by the Heart Institute at Cincinnati Children's and University of Cincinnati. And we looked at our standard group exercise program, and then we implemented an interval exercise program. And these were obese 12 to 18-year-old patients, and we wanted to recruit 10 folks in each arm. And our plan was to do 3 days a week of exercise for 4 weeks and look at mainly feasibility and enjoyment, but also their oxygen uptake, so their fitness level and BMI before and after the intervention. And the incentive was a $10 gift card for each week that they could make it into a complete set of sessions. So for the testing before and after, we did graded maximal exercise test on a treadmill using a Cosmed portable unit to measure oxygen uptake. And we were looking at their fitness level before and after, but also we're using their fitness test to measure their exercise capacity, because then we could map that to heart rate. And then I'll show you what we're using in a second here. But then we could use their heart rate to try to get to them to those different intensity levels during the exercise sessions. So the interval exercise sessions ran at night. There was 10 minutes of warm-up, 30 minutes of the interval exercise. So we did 10 cycles with 1 minute at 80 to 90% of estimated exercise capacity, 2 minutes at 60%, and then cycling back and forth, and then at the end, 10 minutes of cool down. In the controlled group, they did the same warm-up, and then they just stayed at the same intensity for 30 minutes, 65%. And we looked at their effort during the class. We had them wear these polar heart rate monitors so we could track their intensity level. And there are a lot of different activities that we did to encourage this interval exercise. We didn't just have them get on a bike or get on a treadmill and have them go up and down in speed. We had them do some games in the gym, jump rope, races, So a variety of activities to cycle through the intensities. And here are some of our results. Both groups, approximately 14 years old, mostly female, mostly African American, similar high attendance in both groups. And we found at baseline their BMI was in the low to mid 30s. They did not have a significant change after 4 weeks in their BMI, and there was no difference between the two exercise protocols. Their fitness level at baseline was in the high 20s. There was a slight increase. It was reached significance in the continuous group. No difference between the two protocols. But if we look at fitness a little bit differently, and this is a different topic of discussion about whether you should index oxygen uptake to total mass or fat-free mass. But when you index it to lean mass, we also saw that increase in fitness in both groups reached significance in the high-intensity group, also no significant difference between the two groups. When we looked at a little bit different measure, we measured their oxygen uptake at 9 minutes. And I'll show you a plot of that on the next slide. And this is you got to think about this a little bit different than fitness. So cardiorespiratory fitness, the higher your milliliters per kilogram per minute of oxygen uptake, the more fit you are. It's a little bit opposite with when you just measure it at a certain time point. You're measuring the oxygen uptake at 9 minutes, and if it goes down, that's actually an improvement because they're gaining in efficiency. So it's taking them longer to reach their maximum output, and so they're not as close to their maximum at 9 minutes. So on the x-axis here, we have the post-test oxygen uptake at 9 minutes, y-axis pre-test. So up in the upper left, these are the folks that declined, and this is what we're going for, and an increase is not favorable. So most of them were close to not much of a change, but more of them improved at this measure than not. But one of the main things we're looking at is, could these kids do it? Was it going to be fun for them? Were they going to enjoy it? And when we asked the kids in the interval exercise program, universally, they rated the program highly. They also reported, and this is in the interval group, that they enjoyed having the heart rate goal, they'd continue with this type of exercise, and they'd recommend it to a friend. So our conclusions from this were that this interval exercise protocol is feasible in the group exercise setting that we had. I think 4 weeks is probably a little bit short to see many of the changes in the outcomes like BMI and fitness. And I think that bears out with some of the other studies that have been done too, because 8 weeks and 12 weeks are a little bit more common, and that's where folks have seen some of these changes. And another thing that we realized is that in our standard group exercise class, we were kind of already doing interval exercise. In order to keep the kids moving, they had to do a variety of activities. And so there's a little bit of a natural up and down cyclic nature to it. So it wasn't really that much of a stretch to implement some of these interval aspects. And some of the barriers that people sometimes come up with when you talk about interval exercise, they kind of get a little bit worried. Is that going to hurt? Are kids going to get injured? It seems too intense. Are they going to not like it? And we didn't find any of those barriers to be the case in our experience. So since we performed that study, people have pooled some results from quite a few different studies in kids. Costigan came out with this paper in 2015 where they looked at interval exercise for fitness in adolescents. And compared to control group, so this is maintaining usual behavior. This is not compared to continuous exercise. They found that there was a large effect on fitness and that there was a medium effect on BMI and body fat and body composition. So I think for future directions on this topic, I think we need to think a little bit more about injury risk. It wasn't our experience that was a problem, although we didn't design the study to detect whether there was a difference in injury risk between the two groups. And there's not really any good evidence out there to tell us with much certainty whether interval exercise is associated with higher incidence of injury, lower incidence of injury, or if it's about the same compared to more traditional exercise protocols. And I think one of the other things that we need to look at is how can we take this from the controlled setting and adapt it for the community. And there might be some challenges with that because of the heart rate monitoring and monitoring of intensity and trying to get younger kids that might not understand that concept as well as adults to do that. But if we want to use this protocol, which I think has a lot of potential and advantages in some of these populations, I think we need to figure out how we can do that on a broader scale. But like I was saying before, some of the natural programs that we do for kids, they're not that far off from these interval protocols. I think kids have figured this out long ago. It's really the adults that are catching up to this concept of interval exercise, the cycling up and down. It's really what play is. It's what kids are doing naturally. They're running around for a little bit, they're resting, they're running around, they're resting. So I think there's plenty of evidence that shows that this is good in adults, increasing evidence that that's good in kids. And so I think we're going to keep looking at this, and you're going to see more and more about it as we go forward. And if you guys are interested in experimenting on yourselves, you can go home and try this tonight. And some trainers down in Florida published a paper where they looked at or designed a few different exercises that you can do in a home setting in the office. Just all you need is your body weight and a chair. And then the New York Times wrote that up and published it, and it's had some attention. It roughly follows the Tabata protocol. You do 30 seconds of exercise and then 10 seconds of rest. And so the New York Times called it the 7-minute scientific workout. And how many of us or how many of our patients can say, I mean, nobody has time for exercise, but how many can say that they don't have at least 7 minutes? I mean, it doesn't take very long. And you saw from some of those studies that you can see a benefit from this type of exercise in a pretty short period of time. And so there's some apps that you can find that follow this protocol that can cue you onto the next step. And I think this is another future direction that we need to look at, wearable tech and this technology that our patients are walking in the clinic and carrying in their pockets that we can really utilize to help them become more active and stay active. And so I think you're going to see this protocol used on younger and younger children with and without some success. So thank you. And I finished early, so I left you with 7+ minutes, so you can go out and try this exercise routine right now. But I'd like to open it up for questions now. Does anybody have any?
This is just a definition question that you may have answered already, but in terms of how the intensity is measured or calibrated, what does 170% intensity mean?
Great question. So we're tying it to a maximal fitness test, which is a measure of aerobic capacity. So when you get somebody on the treadmill, you hook them up to the mask that measures their oxygen uptake, and then they work out in a graded slope for a while until they hit their maximum. But that's over several minutes. And then that's what we define as 100%. And then we can see what their heart rate was at that point, and then go back. And then when they're doing short bursts, they could potentially go above that. So they could go to, what we call supra maximal, because it's just a short period of time. So they're doing that short anaerobic burst. So that's how you get above 100%. You can't sustain that. I mean, they wouldn't be able to sustain that for a period of time. But that's why you go over 100%. Up here, Dr. Nathan.
Thanks, Nick. Great talk. I'm curious to know if there's any data on the longevity of this type of exercise. Do people, once they've been taught on it, are they more likely to continue with that kind of activity versus continuous, like just jogging or something? Is it more palatable for people to do that?
I haven't seen anybody formally look at that. I mean, there's indications, like from our survey of the kids, that they're interested in doing it, but that doesn't mean that they're actually going to do it. And so I think that's another good direction that we could go in to investigate this a little bit further. I have my theories about how this might be more achievable in the long term, especially if you're spending less time. You don't feel like it's a big burden. So I think there are definitely advantages. But as far as the long-term adherence, I haven't seen any studies that have looked at that yet.
And then the second question I had for you is, which is somewhat related, is has anyone studied or applied this to the home environment? So rather than coming into the research center to do this high-intensity training, you're given sort of the menu and say, here's what we want you to do, versus the other group, just to sort of see if can people carry this out, and again, is it something they can stick with over the long haul?
Yeah, another great question, and another great opportunity for future research. When most people have looked at this, they've been pretty strict with defining the levels of intensity and the duration, and so I think they've felt more comfortable doing it in a controlled setting where they can pretty tightly regulate that. So I haven't seen it, but I think we need to look at that to see if people can do it. Excuse me.
Just to follow up on that point that was made, it's been shown that if you want to get older adults back to be fit, there's a long tradition of walk-run training, which is basically interval training. So it actually is more palatable to many people, especially when they're trying to get going. It also causes some mental engagement for them because they have to look at their watch and keep track of things, which some people get really bored. Other people like a long run and work through the problems of the day, and other people need something to keep their mind engaged. That might be the music or the podcasts they're listening to, but for other people, it's looking at their watch. I had a question about, I'm a rheumatologist.
Yeah.
You guys have a ton of rheumatologists in Cincinnati. I'm wondering if this has been applied to any of the kids with arthritis. There's usually a concern, at least on the parents' part, about they're letting their kids exercise, but in fact, most of our kids get excellent control and can do athletics, but study after study seems to show their fitness really doesn't match the control group. So there's probably a need for formal programs, and I haven't seen one yet that is going to win an award for engagement and success.
Yeah, we have not worked directly with that group, but I think that would be a great population to try this in. I just was seeing a patient the other week with a history of JA who had a knee injury, And I think there's a lot of concern from the parents. And so there might be a little bit of an element of sick child syndrome that they're not sure if their joints can take it, even though consistently they come in and the rheumatologist says, no, you can do this, you can do this. That at least in this, one patient I saw recently, I detected that concern, even that this kid was active, but they still had this concern that this might flare up at any point, and what would be safe to do, what wouldn't be safe to do, and how this might affect their exercise. So I can see that just from my experience. It matches with what you're saying about those kids being a little bit less active. But I think it's definitely worthy of investigation. Other questions? Oh, yeah.
So for your activities for the kids, it's easier for me to conceptualize this. With the activities for the kids, what did you do to ensure the 170% or those types of things on the regular, like the games? It makes sense on a bike, on a treadmill, you can just set things.
It was basically like they had whistles and they had timers, and it took a couple people per class to monitor all the kids, but the kids also knew what their goal was. So with the kid looking at it and the couple monitors, and it was real like, let's go. You only got 10 more seconds. You only got 5 more seconds. Let's really keep moving. That was how they did the motivational piece of it. But it's still a challenge in that setting when you have a variety of activities. It's probably a little bit easier to plug a number into a treadmill, and you know that that's going to take you up to a certain intensity level. So I think that is a challenge. All right. Well, thank you guys so much. I appreciate you coming. Get a little bit extra time at the end here.